What is acupuncture? When people hear acupuncture, they think of needles and they go running out the door. But acupuncture is more than just needles. Hi, my name is Fitz, and I'm an acupuncture physician out of Miami, Florida. And I want to talk a little bit about acupuncture and what it does and what exactly what it is. But before we begin, I got to go back a little bit. Acupuncture falls under TCM, which stands for Traditional Chinese Medicine. This medicine was discovered thousands of years ago in China. It has been used for thousands of years. And at this point in time, we all know that it actually works. TCM has a different modalities, not just acupuncture. We have acupuncture, we have cupping, we have moxibustion, we have herbal recommendation, diet recommendation. We have tuina, which is a type of massage. We use super thin acupuncture needles. By super thin, I mean almost as thin as your hair. Each needle is used one time and then we discard it. A body is full of acupuncture points, usually named after organs. These points are along channels or meridians. So, for instance, you have the liver channel, your spleen channel, your heart channel, your stomach channel, or meridian. Okay. So, when somebody comes into my office, I do a full exam using the TCM principles. We check the tongue, the coating, the color, the size. We check the pulse, if it's wiry, if it's deep, if it's weak, if it's thin, if it's rapid. And then we check just the physical features of the patient, the eyes, the color, how to walk, how to stand, if they, lean to one side. We do a full exam. And then once our exam is done, we come up with a diagnosis or a pattern. We call it patterns. Okay. As acupuncturists, we don't put a bandage over your issue. We find the root of the problem and try to solve it. I had acupuncture done on myself many times before. And let me tell you, the needles do not hurt at all. It does not hurt at all. Here are some of the things that acupuncture covers or acupuncture treats. We treat people with headaches, migraines, sciatica, pain, general pain in general, low back pain, insomnia, infertility, stress, anxiety, impotence, low bone density. So there's a variety of health conditions and elements that we treat. Our type of medicine is not hocus pocus. We're not, we don't just guess what's going on. We actually do an in-depth research. In-depth exam on our patients. For example, let's say we have two patients come in, for headaches. Just because somebody comes in, just because multiple people come in with the same issue like headaches, doesn't mean they have the same pattern. Okay? Because just because two people have headaches, it can be caused by different things according to the TCM principle. That's why we, as acupuncturists, we go to school in depth to try to figure out the best way we can to help people. We don't use any medication or drugs. We do provide herbal recommendation, Chinese herbs and Chinese formulas. And let me tell you, they work excellent. They work excellent. Me personally, I'm working on certain research also because in my practice, when I see patients, one main thing that all of us suffer from is inflammation. Acupuncture, in research, has been shown to reduce inflammation. And if you want to break it down to the Western medicine definition of that, is that acupuncture has been known to regulate the T regulatory cells. T regulatory cells have to be balanced. If it's not balanced, if it's too low or too high, it can cause inflammation. If it's too low, it can cause, autoimmune disease if it's not balanced properly. And there's an acupuncture point called stomach 36 that can regulate the T regulatory cells. Every day, Western medicine, which is regular medicine, and TCM, which is Eastern medicine, are combining because medical doctors are seeing the benefits of acupuncture. As an acupuncture physician, we're not in competition with the medical doctors. We actually want to work with the medical doctors. At the end of the day, the number one priority is the patient, are the patients. So if I have a patient that comes to my office, if I feel like he or she has to be referred to a medical doctor or specialist, I will do that. And I will hope a medical doctor or specialist will do the same. Because again, we're not in competition. We're trying to help the patient the best way we can. I've been practicing acupuncture since 2014 and 15, and I love it. I love it. I helped a lot of people. But that I mentioned, acupuncture is also good for menstrual issues. Ladies, if you're suffering from menstrual issues, don't suffer no more. When I tell you acupuncture works well on menstrual issues, in some cases, it works instantly. Instantly. I have so many women out with menstrual issues before. They thank me a lot. Did you know that sometimes menstrual issues can lead to headaches or low back pain? Did you know that? As acupuncture physicians, we know that that there could be a connection from that. Ladies, next time your cycle comes on, check to see if you also have low back pain or even a headache. Because in some cases, not all cases, it can be connected. It could be connected. I love being an acupuncturist. I love being an acupuncture physician because I'm in a position where I can help people get balanced and get healthy. In addition to acupuncture and cupping and tweener and moxibustion, we also do diet recommendations. We actually recommend which type of food to eat depending on your pattern. If you have excess heat in your body, then we tell you to eat more foods that are more cooling. You get it? So there's a method through our madness. So I don't want you to think. So what you take away, so the number one thing I want you to take away from this video is that acupuncture is not hocus pocus medicine. This is real medicine, and research every day is showing that these acupuncture points actually work. Scientists are studying these acupuncture points and realizing they actually work. This was discovered thousands of years ago. And now, in this day of age, it's being utilized even more and more. So please don't hesitate to get acupuncture. I think everyone should get acupuncture at least one time. You'd be surprised. You'd be surprised. If you have any issues, health issues, of course, always go to your doctor first. I'm gonna be very clear. Always go to your regular doctor first if you have any issues, health issues. I'm gonna be very clear with that. Right? Now, talk to your doctor. If your condition isn't getting better, if it's getting worse, talk to your doctor and ask him or her, do they recommend acupuncture for certain things, for certain conditions? Because chances are they probably will recommend acupuncture for certain conditions. All right. So this video is for educational purposes only. I'm an acupuncture physician. I'm not your acupuncture physician. So always check with your physician for any health questions that you have. All right. So once again, my name is Fit, the acupuncture physician. Please don't forget to subscribe and like. And then I'll see you next time. Okay. Peace.